Okay, Dan Brown here from MGE Management Experts. I'm the Senior Service Consultant. I'm here with Dr. K. Dr. K, welcome.
Welcome. Thank you. I'm glad to be here.
Yeah, good. Hey, listen, great that you're here at MGE. It all began with the new patient workshop.
Right.
And, granted, you haven't even opened your practice. You're mid-build.
Right.
Congratulations on that.
Thank you.
Tell me a little bit about, first, just kind of tell people who you are, your name, where you're from, what the name of your practice is, and then what you got out of this new patient workshop.
Where do I start? I graduated 2005 from dental school, and I owned my practice for about 12 years. And I sold it, started working as an associate again, got a great opportunity to build my practice, found a piece of property in McKinney, Texas. I'm naming it Summit Point Dental Implant Center. And, I was kind of searching for, the right place to kind of learn like more marketing, more business, things like that, aspects of, the dentistry rather than just a clinical. So I got the postcard, like most people have, about the new patient workshop, and, came to the, course, and it was amazing. And you were there, Mr. Jeff Santone was there, and just kind of the way you presented the information, it was just kind of easily digestible. It was the theories you described as far as, digital marketing, SEO, testimonials, the social proof that, you need to have as a doctor to kind of distinguish yourself and also give yourself credibility is, those are the things that I took away. And that's exactly what I'm trying to implement as I'm building my practice, because I don't want to start thinking about that when I open. I want to kind of do that ahead of time. And taking a lot of the tips that you've recommended, from that course, I'm implementing it already. So
Great. Well, so you were in practice before,
right.
Had your own practice. What was your familiarity with marketing at that time?
It was really hit or miss. It was just kind of things on Facebook groups and, just hearsay and, and I would just kind of really trust that company. And sometimes it would work, sometimes it wouldn't. But it was really trial and error, and it was more error than trial, like wins. But I really talking to some of the other clients from MGE, from the new patient workshop, and some of the local doctors that have gone through the program. They recommended some of the things that I'm implementing, like patient testimonials and kind of getting that emotional factor out to the public, through, whether it's Facebook or through, YouTube, things like that, before, after photos. All of that is kind of things I've been accumulating over the years, and I'm trying to use that for the marketing. So
it's great. And so you haven't even opened your office, but
right.
Now you've got plans for, well, you tell me some of the things that now that you're this marketing specialist that you have put in place. And you showed me some of your videos that you've done,
right.
Totally impressed. But give a list of some of the things that you've done.
So I have to give credit to my wife as well, because she's been helping me with a lot of the ideas. She's gone through some of the marketing programs. She's watched the new patient workshop live stream when you had it a couple of months ago. And basically, what I've been doing is getting patients to talk about me, to describe their experience with me. And, some of them over a year, some of them up to 15 years ago, they've been talking about that. Also, just kind of creating credibility by information. Like I've been using videos to market my practice because it's a ground-up construction. So, I'm kind of getting the community excited about it, as far as, what's happening, and kind of throwing my name out already in the community. And, people driving by, they kind of see the area, and it's a really good location, so people they know where it is. And as far as, that's pretty much it. Just trying to get myself involved with social media. We've been making videos, so search topics like people research on Google. What is an implant, or how much does an implant cost, or wisdom teeth, does it hurt? So all these search terms is videos we're making on that, 2-3 minute videos, just really easy, basic information for the public. We're having a videographer edit it, and we're putting it on our YouTube channel and eventually on our website.
Great. Well, it just sounds like you're ready for a launch like we haven't seen.
I hope so.
Yeah.
Yeah, we'll know a few months.
Yeah, all right, good.
Yeah.
And I think you've learned from marketing that it is a bit of trial and error,
Right.
as you said before. But tell me what your confidence is now in compared to prior to hooking up with us and going through the new patient workshop.
I wouldn't have done 90% of what I've been doing, having not gone through the new patient workshop, and just having the access to be able to talk to you and communicate with you even after signing up with that, and the advice you gave me, and again other MGE clients, it's been priceless. I mean, it's been amazing. So I'm not trying to recreate the wheel. I'm just doing what works, and what the whole idea of what I'm doing is I want people that are searching for a doctor to kind of have a little bit of knowledge as far as what I do and who I am, and as far as some of the services we offer. Because it's not just something you're trying to sell to people. Like, people are genuinely interested, okay, when I have a tooth extracted, what should I expect? So I'm also giving informational content free, and not really trying to promote my practice or my name, but just kind of creating that information and for people, and just kind of brand recognition. So I'm trying to brand my practice name, and in another way I'm trying to brand myself as well. So
fantastic. Great. And then kind of lastly, what would you tell people about MGE, the new patient workshop, and this guy Dan Brown, who says he's a marketing guy?
All right, if you've been on the fence about wanting to be coming to the new patient workshop, go ahead and sign up right away, because it will change your life. And it has changed my life, and I haven't had no regrets signing up and being part of the MGE program. So
awesome. Doctor, best of luck. It sounds like you're ready for a heck of a springboard in the future. Well done to all that you've put in place thus far. And watch this space, right?
Right. Thank you.
Thank you.
Appreciate it.
And for you, watching this, you deserve the same success. At the MGE New Patient Workshop, I'm going to show you a system to get your practice seeing more high-quality new patients right away. As a matter of fact, the average attendee sees a sustained 42% increase in new patients. We've helped your colleagues to generate millions of new patients and over $750 million in additional revenue just since we've done this workshop. And you might say, well, what does that mean to me? Well, I can tell you this. If you're seeing about 30 new patients per month, that's going to be 12 more new patients for you every single month. That's 150 more new patients every year. And we'd really like to help you with that. So sign up today. Go ahead and click the link below to find out more. I look forward to meeting you there.